so that makes sense. So now to a health alert for women. A new study suggests the risk of women dying from cervical cancer might be much higher than previously thought. African-American women are dying at a rate of 77% higher than previously thought. For white women, the rate is 47%. Joining me this morning is Dr. Scott Ackerman with Ackerman Cancer Center. Good morning to you. Thank you for being here. It's always good to see you. I want to talk about those statistics in just a minute, but first let's talk about this new study because, you know, when you read this, it'll take your breath away because, I mean, of course, cancer is a killer, and something like this for women in particular who maybe don't go to their gynecologist once a year, this is an eye-opener. You got to pay attention to this.
Oh, absolutely. So over the past 40 years, we've seen the death rates from cervical cancer go down drastically, dramatically. They've gone down. And this new study from Johns Hopkins School of Public Health has shown that if you take a closer look at it, they took a closer look at it, and they excluded those women who have had a hysterectomy. And once you take out those women who have had a hysterectomy and just look at those women who have an intact cervix and uterus, that the death rate hasn't gone down as much as we thought. It's gone down, but not as significantly as we have thought.
Well, and the hysterectomy is important because for those maybe who are younger or perhaps older, the hysterectomy, when you have a hysterectomy, it also removes the cervix, correct? So you're taking those numbers out of the equation, which is why now we're seeing a jump in these numbers. Is that
exactly
a proper?
Women have hysterectomies for all sorts of reasons, usually because of heavy menstrual bleeding or cramping, that sort of thing. So once you remove the uterus, you've removed the cervix, and so the risk of cervical cancer is eliminated. So if you just look at those women who have not had a hysterectomy, the incidence and death rates of cervical cancer are significantly higher than the population as a whole.
So we weren't getting the correct numbers, quite frankly, because the hysterectomy numbers were not included. So, so let's look at this disparity between 77%. I mean, anything high is not good, but 77% higher among African Americans and 47% among white women. Why the jump in number? 77 is very high in particular.
Well, there's an increased incidence of cervical cancer in African American women compared to white women. And in this study, when you take out the hysterectomy patients, the death rate from cervical cancer goes up more markedly in African American women than white women. This disparity, with all sorts of postulation as to what the disparity is, but we think the disparity is because of access. Black women have a disproportionately limited access to health care. They're disproportionately lower socioeconomic groups, and they disproportionately don't have screenings compared to white women. So if we want to have an impact on the best impact on saving lives, one of the first things we should do is find ways to eliminate these disparities.
And then second, when you're addressing cervical cancer, there are preventatives. I mean, there are ways to catch something, for example, early.
There's two ways to prevent cervical cancer. Number one, have screenings. So screenings for cervical cancer can find pre-malignant cells, can remove them. It can also find early stage cervical cancer. That doesn't really prevent it, but it saves lives. Early stage cervical cancers that are very highly curable with surgery. If cervical cancer is caught early, it's very, very curable. And the Pap smear, which is part of the screening, and the HPV test, which is part of the screening, is a way to prevent and to diagnose cervical cancer early. Number two, there's a vaccine now. We know that 99% of cervical cancers are related to the human papillomavirus. So our recommendation is now that all children, all girls and boys, have the HPV vaccine when they're young. Recommendation, excuse me, the recommendation is between the ages of 11 and 13 they have it, but if someone hasn't had it, they can have it up to the age of 26.
I want to go back to the screening guidelines also that you mentioned, because we've got some information, because this is important information. So starting at the age of 21, women should have a Pap test done every 3 years, and then at 30, that increases.
So we recommend that all women at the age of 21 have a Pap smear every 3 years. If that Pap smear is normal, every 3 years is fine, but if there's an abnormality, the discussion between the physician and the patient should be maybe have it a little bit more often. Once the age of 30, women should have a Pap smear every 5 years, but with that, they also should have the HPV test. The HPV test detects whether the human papillomavirus is in the cervical washings, in the cervical cells, and if it is, that puts a woman at a higher risk of developing cervical cancer. Once a woman's 65, the incidence of cervical cancer goes down, and so there should be a discussion at that point with the woman and her physician as to whether or not she should continue to have the screenings. So it depends on her overall health and whether she's HPV positive or not. So that's a discussion to have after the age of 65.
And I think that this study also is a reminder to all women that you need to just engage your gynecologist in these kinds of conversations more than you maybe did. Sometimes this is not the first appointment that a woman sets up every year, but needs to now.
Exactly, exactly. And having that discussion is good because you may want to have the screenings more often, depending on
what your risk factors are, sure.
Exactly.
Doctor, thank you for being here. Do appreciate it. For the latest health news, by the way, and more on this particular study, you can find it on our website, news4jax.com, along with this interview, which we posted later this morning on the website. All right, we want to take a live look outside.